We're here today at McKenzie Health System to show you how we've been working with Ascension, Michigan since 2012 to provide comprehensive care as quickly as possible and connect our patients who may be having a stroke with a neurologist and life-saving treatment.
Good morning. My name is Delmarie Ayersman. I'm with Ascension, Michigan with the telemedicine team. I have been with Ascension 31 years this year and 3 years with the virtual care team. I am happy to have an opportunity to talk about our collaboration with McKenzie Health. This is our telemedicine device. It has a high definition camera. The physician can pan, tilt, zoom in on the patient. And we use this device to bring a neurologist from distance into McKenzie to be able to work collaboratively with the team here and assess the patient and make recommendations for stroke treatment. Often in rural areas there's not access to neurologists, neurosurgeons, and other specialists who specialize in the care of the stroke patients. So this technology really enables us to partner in the care of the patients here at McKenzie.
Hey, Mr. Jones, I'm Dr. Hammond. The EMS brought you in. They told me that you're having stroke-like symptoms. Can you tell me what time everything started at?
Approximately 2 hours ago.
And are you right-handed or left-handed?
Right-handed.
Can you tell me what you feel right now?
Numbness in my entire right side.
Okay. Right.
Including the face.
All right. Do you have any medical problems currently?
No.
Right. Any family history of medical problems?
No.
Do you smoke cigarettes?
No.
Alcohol use?
No.
All right. Very good. Do you feel nauseous at all at this point?
No.
Lightheaded?
Yes.
Okay. Do you have any loss of feeling of any parts of your body at this point?
It's arm, little facial numbness.
How about your legs?
No.
Okay. Have you ever had a history of atrial fibrillation before?
No.
Okay. All right. I'm going to do a quick exam. I did see your EKG when the EMS did send the EKG to my phone before you came in, and it looks like you don't have atrial fibrillation on this EKG, which is a good thing. So let's check you out. All right. Can you give me a big smile, Jay? Mr. Jones, big smile. Good. Can you raise your right arm for me? Okay, leave it up for about 5 seconds. 1, 2. Okay, put it down. How about your left arm? 5 seconds. 1, 2, 3, 4, 5. Can you raise your right leg? 1, 2, 3, 4. Right, your left leg. Good. Mr. Jones, can you feel me touching your leg here?
Yeah.
Does that feel the same as when I touch here?
Decreased on this side.
Okay. How about your arm? Do you feel me touching your arm here?
No.
No? Okay. Do you feel this when I touch here?
Yes.
All right. Can you feel me touching your forehead?
No.
Okay. How about, do you feel this here?
No.
How about this here?
Yes.
Okay, very good. All right. Do you take any medications currently? Any medications?
No.
Okay. All right. Well, Mr. Jones, I believe that you are experiencing a stroke at this point. I'm going to consult my stroke network and get the neurologist on the line, and we'll talk further, okay?
Okay. All right.
Hi, sir. I'm Dr. Paul Cullis. I'm a neurologist with Ascension Health, and I'm here to evaluate the problems you're having. The doctors are telling me that they have found that you developed this morning some numbness on the right side a couple of hours ago. Can you tell me how that happened?
Just come on suddenly.
Has that ever happened to you before?
No, never.
Is it just numbness, or is there also weakness?
Weakness in the arm, especially.
Are you right-handed?
Yes.
And are you having any trouble talking?
No.
Okay, and do you think that the symptoms are getting better or worse?
Staying the same.
Okay. Well, it looks like you might have had a small stroke, and so we've been evaluating what we should do to try to help you with that. The symptoms appear to be quite mild at the present time, but certainly we need to get some testing done to see whether there's been any bleeding or lack of blood supply in your brain. So, sir, can you please lift your left arm up in the air for me and hold it up? Just keep it there for a few seconds so we can see how you're doing. That's great. You can put it down again now. So now, sir, what I'd like you to do, please, is raise the right arm up off the bed if you can. Are you having trouble moving the right arm?
Yeah, it's getting more numb.
And it really doesn't want to stay up, huh?
No, I'll get hold of it.
Okay. Just let your arms relax, and can you lift your left leg off the bed, please? Just hold it there for a second. Very good. Okay, now try raising the right one if you can. That one looks a little weaker.
Yeah, now we'll move.
Okay. Can you please open your eyes up and look all the way to the right with your eyes? Now, that's great. And then all the way to the left? Then I'd like you to grin and show me your teeth, please. Good. And can you stick out your tongue for me, please? That's great. Okay, now touch your index finger on your left hand to your nose. Can you do that? The left hand, touch the finger to the nose. Okay, now point it out towards me or towards the doctor's finger. Perfect, okay. And how is your speech? Are you able to speak perfectly normally?
Difficult.
Sounds like it's getting worse now, yeah.
Okay, so
A little more
I have some
slurred at
trouble
this point.
finding words.
Yeah.
All right, well, I understand from the doctor that the CAT scan of your brain is normal, which means that you're not having any bleeding in your brain, but it doesn't mean you're not having a stroke. And so what we normally do in this situation is to give a clot-busting drug, which we call a thrombolytic, to try to break up the clot in your brain that's causing this problem. So that's what we plan to do. There's a small risk of bleeding, but generally this is a well-accepted technique to try to restore function after a stroke. And one of the other things that we'll be doing is looking at the blood supply to your brain with a CT angiogram. It's a kind of a CAT scan that looks at the blood supply to the brain. And because it's possible that if we see a clot or an obstruction of an artery, someone could go in and pull the clot out if the TPA doesn't work fully. Do you understand all of that?
Yes.
So that's the plan at this point.
All right. Thank you, Dr. Cullis. We'll talk more and we'll arrange transfer. Thank you. All right, so at this point, our patient will get the clot busting medication. And because there is a small risk of bleeding, we do want to get him monitored in a neuro ICU. And also, so he can have more of a stroke workup, physical therapy related to stroke patients too. So we are going to get him transferred to a hospital that has those capabilities. And we transfer the patients to comprehensive stroke centers who are highly specialized hospitals, facilities that have the resources that stroke patients need to have the best outcome after a stroke. So we'll likely transfer this patient by either ambulance or by helicopter, depending on how severe the patient would be and what kind of time frame we're looking at too. Now, the reason we asked what time it all started, because you have X amount of time. Yeah, so we have 4.5 hours, kind of give or take, for being able to give this medication safely. If we give it after that time frame, it might not work as well, and also might cause the risk of bleeding goes up a lot higher too. So this patient came at the right time to get this medication. That's why we emphasize with patients, any signs of a stroke, any symptoms at all, get checked out right away, because time is literally brain.
Stroke is a medical emergency, and it's very important, if you have any symptoms of a stroke, to come to the emergency department immediately at your local hospital to get fast treatment, because the faster you get treatment, the more likely it is to work. The thrombolytics that we're talking about have to be given within 4 hours after the onset of a stroke. We use a term, be fast, to remind people the symptoms of a stroke. The B stands for balance, E for eye problems, speech, drooping of the face, weakness of the arms, and other symptoms. So if you suddenly have difficulty with balance, if you suddenly have double vision or trouble seeing, if you have drooping of one side of the face or the other, if your arms or legs feel weak, or if you have trouble speaking, then it's very important to come to the emergency department quickly so that we can provide appropriate treatment. As soon as you get there, we will start evaluating the possibility of using a clot-busting drug to help you. Whether or not we do that, it may be possible for us to arrange for you to have the clot that's causing the problem removed from your brain. Both of these are probably going to require transfer to a larger hospital, and typically we transfer patients to our comprehensive stroke centers, including St. Mary's Hospital in Saginaw, where all these services are available. There is a small risk of bleeding after having a thrombolytic clot-busting drug, and so you need to be in a place where there's a neurosurgeon available in case a blood clot forms in the brain around the stroke, and it may be necessary to remove that by surgery. That's an unusual occurrence, but it can happen. So typically patients that need that level of care get transferred to one of our comprehensive stroke centers where all of this treatment is available.
Today demonstrating the importance of getting care as quickly as possible when you're having any stroke-like symptoms. How use of technology provides additional care and setup to be able to give life-saving treatment as quickly as possible for the best outcomes.